Good afternoon, everyone. Welcome to our August WISC Subcommittee meeting. We have several folks joining us. I know this is a difficult time of the year with school starting back and people winding their summers down. So we will go ahead and get started. We will add folks if they continue to come in. Today, I would like to do things a little differently. We have all but two of us you all are remote. Marshall and I are actually in the office. But so what I would like to do, we have some new faces today as well. What I would like to do is go through and ask you to introduce yourself, your organization, agency, and then your role currently. And that will serve as our introductory activity today. So again, my name is Jim Tackett. I am the School Health Branch Manager at Kentucky Department of Education. So I'm just going to go on my screen and go this route. While we're panned here within the boardroom, I'll ask Marshall if he'll go ahead and introduce himself.
Yeah, I hope my mic is on. My name is Marshall Smith, and I'm the Assistant Director the Division of District Support here at KDE with Jim. Yeah, was there something else I should add?
That's it.
All right. Thank you all.
Kelsey?
Hello, I'm Kelsey Rutledge with Baptist Health Deaconess Madisonville, and I'm the Director for the Baptist Health Deaconess School Wellness Initiative.
Stephanie?
Which one?
Which Stephanie?
Sorry, Stephanie Bungie.
Stephanie Bungie. I am also part of the School Health Branch at KDE, and my role is the Healthy Schools Project Director. So I oversee the cooperative agreement that we receive from the Centers for Disease Control and Prevention.
Crystal.
I'm Crystal Dillingham. I'm the Health Program Administrator or Field Rep for the Central Kentucky area.
Our second Stephanie.
Hi all. Apologies for not having my camera on. I'm not currently in a location where I can do that, but I am Stephanie Barker. I am the Interim Director for the Kentucky Out of School Alliance. So we are Kentucky's statewide after school network and also the Kentucky affiliate of the National After School Association.
Abby.
Hi, I'm Abby Henshaw. I am with KDE School Health Branch, and I am the Western Field Rep.
Angie.
Hi, I'm Angie McDonald. I'm the State School Nurse Consultant here at the Kentucky Department of Ed in the School Health Branch under Jim and Marshall.
Lindsay.
Hi, my name is Lindsay Swartz. I work as the Policy Advisor in the Office of Finance and Operations here at the department.
Jen.
Was that Jen?
Yes.
Okay. There are too many Jennifers out there too. Hi, I'm Jennifer Ginn. I'm Director of Communications here at KDE, just listening in to see how we can help.
Thank you. Katie.
Hi, I'm Katie Embry, School and Community Nutrition, and I'm a Child Nutrition Program Manager for the school meal programs.
Beth.
Hi, I'm Beth Martin with the Division of Family Resource and Youth Services Centers, and I am a program planner with the division.
Caitlin.
Hi, everyone. My name is Caitlin Mounts. I work for KDE under Jim and Marshall, and I am the Eastern representative for our state for the School Health Branch.
Layla.
Hi, I'm Layla Brewer. I am the branch manager in the Division of Student Success. I oversee persistence to graduation, chronic absenteeism, Title IV and Stronger Connections grant, as well as alternative education.
Jalen.
Hello, everyone. I am Jalen Stubbs. I am the school health consultant and program evaluator for the Healthy Schools program that Stephanie mentioned, working with the school health branch for KDE.
Miles?
Hi, everyone. My name is Miles Young. I'm the Assistant Director of Communications for KDE.
Brooke?
Hello, my name is Brooke Gill. I'm the Vice President of the Pritchard Committee, and I oversee our work in collaborative leadership with the Community Schools Initiative, Family Friendly Schools Initiative, and the Commonwealth Institute for Parent Leadership.
Vicki?
Hi, I'm Vicki Dempsey. I am the team lead for the Living Well Regional Wellbeing Coordinator team.
Luke DeSand?
Here I am. Good afternoon. My name is Cliptis Grider Jones, and I serve as the Director of Education Policy here at the Kentucky Department of Education, and I also serve as the Executive Director of the Board of Education.
Mike?
Good afternoon, everyone. My name is Mike Ford. I am with the Kentucky Association of School Administrators, where I am the Director of Affiliate Services. And I'm looking forward to working with this committee. I spent 20 years of my 40-year career as a DPP and worked directly with many of your offices in the Department of Ed that have been represented here today, and looking very forward to continuing this great work through this committee. Thank you.
Julia?
Hello, everybody. I'm Julie Pyle. I am a member of the State Board of Education.
Miriam?
I'm writing so fast to write all this down. I'm Miriam Silman. I'm an executive advisor at the Department for Behavioral Health, Developmental, and Intellectual Disabilities, and I am here as a representative for Dr. Tina Robbins, she's our senior executive advisor. And my connection to this work is both through the world of trauma and being trauma-informed and resilience-oriented, and also through the school behavioral health work that the department engages in.
As a side note, Miriam, we will send out some meeting notes so you won't have to frantically capture everything. Thank you.
I knew I had to report back. I was trying to be diligent.
Michelle.
Hi, everyone. Give me just a second. I'm having screen issues. There we are. Hi, everyone. My name is Michelle Searcy. I'm the program coordinator for comprehensive school counseling. And I'm connected to this work, obviously through school counselors, but as Miriam stated, just being trauma informed as well.
Bethany.
Hello, I'm Beth Thomas. I work for Kentucky Department for Public Health in their school health section.
Did I miss anyone? I think I tried to look at screen and then jump to our listing. So welcome everyone again today. It looks like we have 25 folks on right now. We may add a few more. I know we have a few that are missing as well. So hopefully everyone received the agenda for the meeting, and we're going to change order just a little bit based on folks' schedules and availability. What I would like to do is I want to jump down and ask Katie if she will provide us the school nutrition and state federal legislative updates first.
Yes, thank you so much, Jim, for being flexible with my schedule. I appreciate that. And hello, everyone. I think we have slides. Jim, did you get those? Well, as you do that, I can go ahead and get started. So I work with the Division of School and Community Nutrition in the school meal programs. And the first thing that we're going to talk about, Jim asked me to speak a little bit about a KRS repeal that we had this year. So a little bit of background on this. In the early 2000s, Kentucky was, thank you, that's perfect. In the early 2000s, Kentucky, our legislature was extremely proactive in setting state policy that advanced and protected the school nutrition environment, the healthy environment of schools across the state. So they developed a series of regulations that were aimed at ensuring school environments were healthy for students. Fantastic work that was done. Well, as you all know, in 2010, the Healthy Hunger Free Kids Act came out, which put guidelines at the federal level aimed at the same end goal, to create a healthy environment for kids in school buildings. And of course, just like state law and federal law, trying to do the same thing but did it different, took a different approach. I always called it like apples and oranges. And so since then, child nutrition directors in school districts kind of had to navigate, the law of using what's most restrictive, had to navigate between the two, trying to make sure that they were following state policy, their own local policy, and then also the federal policy. And it was challenging. It was very challenging. I know Jim and Stephanie can both speak to that. A lot of times they were just like, what do we need to do? So we were very happy to say that this year we were able to repeal KRS 158-856. It's kind of bittersweet because we love the work that this regulation did. But at the same time, we're grateful that there's been a reduction in administrative burden per se for school nutrition directors, because now they have a single set of regulations that they follow at the federal level. So we're really hoping that there's more time and understanding to put some more meaningful work into the work that they do to support the school nutrition environment. So just wanted to share that. We do a lot of work with local school wellness policies, and hopefully this just makes this a little more streamlined and efficient so that they're following a common set of regulations. Any questions about that? Okay. I also wanted to share just a little bit about school meal programs in Kentucky. Just a real pat on the back to our child nutrition directors across the state. I know that you guys are all familiar with what we call the CEP program, or the Community Eligibility Program. Little background on this. CEP is a variation or provision that is offered through the National School Lunch Program. If a school decides, because it's their choice, if they decide to if they're eligible and they decide to operate this provision, any student that attends the school can receive a meal at no cost to them. There is a cost because, of course, the school is taking on the cost, but it's at no cost to the student, to the family, to the household. And our state was one of the first 3 states in the nation. We at first participated in school year 20. We were a pilot program. Back then it was called CEO. I don't know if any of you all remember that. But it moved from a pilot program to a provision across the United States. So you can see in this chart here in the very beginning from 2011, just how much CEP has grown across our state. 95.5% of the schools eligible participated in school year 24-25, and we'll have an increase in school year 25-26. So just a real shout out. Again, this is an option for school districts to participate in, and most of them, almost the majority of students in Kentucky receive a meal at no cost. So I think that's something really to be proud of. And on our next, do we have a question?
Go ahead, Mary.
I do have a quick question.
Yes.
Why has the total number of sites dropped slightly? Is that just consolidation of schools and kind of those kinds of factors?
This is a kind of in the weeds question. So in the school meal programs, sites and schools are different. So we have a lot of schools in Kentucky that feed in one cafeteria. So in our world, that is one site. And in the school world, it's 3 buildings, 3 schools. And yes, we have consolidation. We have all sorts of things. So that's a great question. Thanks for asking. It's crazy when you get into that level of detail, but you're like, yeah, that makes sense. On the next slide, just a little bit more data to show the impact and access of the program. Here's our year-to-date numbers for 24-25. And again, I pulled these in June after claims were filed in June, but they're always moving a little bit based on revisions and things like that in that nature. But you can see the school breakfast program, 47 million meals this year. It's down from last year, but school year 24-25 was impacted by multiple significant weather events. We had a lot of NTI days. We had a lot of closure days. So the numbers are down in that regard, but you can see total reimbursement is up. So over 123 million for school breakfast and over 300 million for school lunch. Over 74 million lunches served to kids across the state by our school districts that participate in the National School Lunch Program. So just a big shout out to all of our food service directors, all of our program sponsors who participate and make these things possible. And again, you saw those high rates of CEP participation. So a tremendous amount of those 74 million meals and over 47 million breakfasts that were served were at no cost to our kids. So I think that's fantastic work that our school districts are doing. So just wanted to share. Thank you.
Any other questions for Katie? Thank you, Katie. This is obviously critical for the work that each of us do. It's important for our kids to be fed, to come to school, or once they're at school, be able to receive those nutrients so they can function and learn at the highest levels as well. So this is a different conversation, but we're as we come out of the summer season, I know that was a huge piece of our summer programming and summer meals as well. So I would encourage you to check that out as we look at how we're able to prepare our kids for the classroom and other extracurricular activities. I want to move next. We're going to jump back up to our Healthy Schools updates. And I'm going to ask Stephanie to share some items with us in regards to our Healthy Schools work.
Hi, everyone. Hopefully the internet works good. I'm in Fayette County and the Wi-Fi is not the best here where I'm sitting. So hopefully it works out okay. But just an update from the CDC cooperative agreement side for the Healthy Schools work. Our grant year runs June 30th through June 29th each year. And we are currently in year 3 of a 5-year cooperative agreement. So that turned over obviously on June 30th. Our notice of award from CDC was actually a few days late, but we did receive it, thankfully. So we are funded currently through June 29th of 26. So we are still here for the year. So we are gearing up for all of our year 3 activities and starting to plan some professional developments that'll be occurring this year. And then for those not as familiar, CDC required us to work closely with one school district for the 5 years, and we are working closely with Fayette County. So I'll give a little highlight to them for their work that's going on as well, because Angela Stark is the person that whose position we fund at the district level here in Fayette County. So from the state level, though, we're working with the Kentucky Out of School Alliance for their virtual conference that'll be occurring. And I know Stephanie will give an update on that later. But also we are working Kentucky Shape. The summer conference occurred at the end of June, but they also offer another event in October, and that focuses more on pre-service students that are going into the health and PE world. So colleges and universities across the state will be receiving a full day of training and collaboration, and that'll actually occur in October. I think it's the 20th. I think it's that Monday, and that will be at Murray State University. But the day before that, we're going to try to offer a full day professional development opportunity for the teachers out in the western part of the state. They don't see us a lot necessarily from the Kentucky shape side, and I think it's an area that we're missing out on. So we're trying to connect more with them. So we're going to offer them a PD day the day before that, which is amazing. And then, of course, working with our branch to do some trainings in September that I'm sure Jim will highlight, regional trainings for the district health coordinators. And then going to be meeting with Katie. I was able to attend the National School Nutrition Association conference in July, which was amazing. And I learned a whole lot. So I'm trying to see where we can help fill the gaps for food service directors and nutrition education in the state as we go through year 3. And then in Fayette County specifically, where I am at today, they always offer each year a full day of content-specific professional development for their health and PE teachers, which Angela has planned for them and has had multiple sessions going on all day long. So I will have to hop off in a little bit to go help her set up for some of the sessions that are coming up. But so that's being provided today. This was their first day back. And then also Angela is working each year of the grant. She's kind of getting kind of a cohort of schools that she's working closely with. So she worked with about 9 or 10 schools this past school year. So we're recruiting 9 or 10 more, or around 10 to work closely with this school year. And I think she has most of them recruited, just finding a couple more. So she'll be working closely with them to do some school health assessments, set up some school health committees and action plans to, help improve the school health environment at those schools for the students and the staff. And then announcement that'll be coming out tomorrow from the Alliance for Healthier Generations. So that's the school health assessment piece that many schools in Kentucky use. And I know Kelsey can probably speak to this as well, since all of his schools utilize this assessment tool. But they also do a recognition system where you can apply to be recognized as one of America's healthiest schools in 9 different areas. And we thought that was coming out yesterday, but actually won't be released to the public until Wednesday. But I can just say that 9 schools in Fayette County applied, and on all 9 schools will be recognized. So that's really kudos to the hard work that Angela has done in helping those schools improve those health opportunities for students. I think that's mainly it for now. Again, we're just gearing up for our year 3 activities and doing a lot of planning as well.
Anyone have questions of Stephanie? I will say, to Stephanie's point, we are scheduling district health coordinator meetings in the fall. So our branch will be traveling to Moorhead, to Columbia, and to Madisonville in September. Those will be in person. And so typically we have a fall and a spring meeting with those individuals to talk about upcoming legislation, to talk about needs that they have in the field, technical support, assistance, PD needs they have. So last year we went to them. Again, this year we're going to them in the fall. It's a little easier, I think, for them to get out of the district in the fall as opposed to the spring, with weather, with spring break, with graduations, and all of those things that hit in the spring. So if you're interested in that, let us know. We will be putting that save the date on our website, and we're happy to share that with the team and the notes that go out. I would like to now sort of pick up a conversation that we had talked about several months ago, but in working collaboratively at KDE across divisions and across offices, I think, and I'm not sure who I'm turning this over to first, Miles or Layla, but we want to revisit some of our work currently that's going on around chronic absenteeism and some resources that have been made available by the department. And we felt like this would be a great group to share that with because of your reach across the state and the different stakeholders. So Layla, it looks like I'm turning it over to you.
Yes, thank you. So as you know, we're getting ready to start off the school year, and with that, we just want to make sure that kids are actually in attendance. And so we are starting off a campaign around attendance matters. So there are 4 positive conditions for learning, and that is academic challenge and engagement, adult and student well-being and emotional competence, physical and emotional health and safety, and belonging, connection, and support. So our campaign this year is piggybacking off one that we did last year around, we miss you in school. So this year we're doing one that's more focused on belonging, since that is one of the positive conditions. So our office has worked with Miles in the Division of Communications to create some ad campaigns and different things to just really emphasize that point. So I'll go ahead and turn it over to Miles.
Hello, everyone. So I want to first thank Layla and her division and everyone that's kind of helped. It's been a big team effort, and we're starting to put bows on everything, wrapping it up. So Jim, do you have yeah, I think it's coming. Yeah. So here is one of the main graphics with the You Belong Attendance Matters. Jim, if you want to, yeah, looks like you're going to expand that. But this is the main graphic that you'll see across billboards. You will see across some buses. You'll see online on display ads. I'll go through that. Jim, if you want to go to the next slide for me. We're working with several stakeholders and vendors to have an online presence as well as outside presence as well. So on the online presence, we have a YouTube ad, and I wanted to do something extra special this year. So we produced in-house our own YouTube ad to have played throughout the state, and we identified some regions and zip codes that we'd have the ad show first and that kind of thing, but we were able to configure it where it's going to show statewide. So outside of a YouTube ad that's 30 seconds, in which hopefully we can play here in a little bit, we have an audio streaming ad that will be on all major podcast networks or paid podcast networks throughout the state, and then online streaming ad, which it's the same as the YouTube ad, but your big streaming services, with the exception of Netflix and Amazon, if you meet a certain demographic, that ad will appear throughout, on commercial breaks. And then we have display ads. If you're visiting websites, whether it be ESPN or Yahoo or, whatever your favorite news site is, we have contingencies in place where those ads will show up based on, demographics that we have identified. So, and that's just the online presence. So we have also entered in contract with Rupp Arena. Starting this week and into next month, if you're ever in the Lexington area, run by Rupp Arena, you'll see that first poster there. We have entered in contract with Yum Center. And I have a picture of the ad that's out there, and it's really cool to see. But at Yum Center, we have an exterior display board out front, and then 400 interior display screens, on their TVs and stuff. And then we will have printables at the different basketball camps and stuff. So in the next 2 months, we will have a large presence at Yum Center. And then billboards. We have 38, kind of like last year, we have 38 billboards located around the state, with 10 and 11 being in Lexington and Louisville. And then we have a big presence in Eastern Kentucky, and then some in Western Kentucky and some up in Northern Kentucky. Next, we will have something new this year and super excited about is the Public Transportation Authority, or the LexTran is what's in Lexington, the public transportation buses. They have 48 buses, and we negotiated contracts to have all 48 buses represented with our campaign. And so that first screen that you saw with You Belong Attendance Matters will have interior cards on, yep, that right there. They will have those interior cards on all 48 buses. And then 12 of those buses will have long wraps on them, not wrapped all the way around, but on the interior or the exterior on the passenger or driver side will have that graphic. And it's several feet long. So super excited about that. Also on the Lexington buses, one of the cards per bus will be translated to Spanish. All right, I'm almost done. Sorry. The Public Transportation Authority in Louisville, which is TARC, has 85 buses that are running in the area. And we did a contract with them to have 2 advertisements on the interior, and then 4 buses will have exterior side panel graphics, kind of like the Lexington area buses. And plus, we're able to advertise on bus shelters in Louisville. And so we were able to secure 50 bus shelters, and working with Layla and Christina and a few others, we were able to identify some shelters in some areas that we would like to hit heavy, and super excited about having our advertisements on those shelters. And when I say advertisements, I'm not talking like 8.5 by 11 pieces of paper. We are at 96 inch by 58 inch big behind glass posters on these shelters, and the same on the bus. I believe they're 10 feet long on some of them. So super excited. And the last entity that we will be advertising, and right in time for the state fair, is the Kentucky Exposition Center. They have 3 main gates with the digital billboards there, and they will have this ad running. Jim, if you want to go to the 4th slide, I have some pictures of some of the ads already running. All right, so this is some of the advertisements already at the Yum Center and then the billboards. So super excited about that. Danielle, our graphic designer, did a great job working with everyone to really capture, the students at work and in the classroom, looking happy. And then lastly, I have a commercial. It might just be better to put that in the chat if you want. That way everyone can watch it at a later time, because I think it might have some rendering issues. But we have a commercial that's live on YouTube that the vendor has already taken, and it's streaming online. So it's really cool. And it was narrated by kids. And the kids did a great job, getting the message across. So I will put that in the chat for everyone to watch at a later time. But does anyone have any questions for me or Layla and KDE with this campaign? I'm super proud of it. Our teams worked hard. We've negotiated some contracts and got more bang for the buck. So super excited. I think that's it, Jim.
Yep, and I will add that on the commercial, it does take you to the KDE homepage, and on there is an Attendance Matters button for people to be able to go look at resources, and I will put the link to that webpage in the chat as well.
That is correct. Thank you, Layla. Yeah. So we're still updating our webpage on our end, but it's up and going. So we wanted all entities to be running by the 1st of August, but everything will be up and running the next week, and we've got 2 months of hitting it hard and excited.
Anyone have questions for Layla or Miles? I know there are several comments in the chat, and I think as we move into member updates in just a little bit, you all are already making connections as to other things that you have going on within your own agencies or entities that this would align with and fit nicely with. So again, another great purpose for this group in regards to the collaboration that can occur not only virtually, but also in person when we're able to be in persons as well. Miriam.
Sorry, the newest member always has all the questions. My apologies. But I'm just curious to know if last year, I love this campaign, and I think I saw some of it last year, even though I don't have school-age kids anymore. But do you have any metrics or any sense about what the influence was of the campaign on attendance? Like, did you see in places where there was higher saturation of the campaign that you had better attendance overall, or was there any way to measure?
Layla, Jen, okay. So you said you're the newest member. I'm 6 months in, so I might have you beat.
No, this is my first meeting.
Oh, okay. Yeah, same. So, Layla, do you have metrics or
Layla, do you have those metrics?
I do not have the metrics. Okay. Yeah. Just
from conversations we've had before, we saw that we were driving people to the chronic absentee webpage when after the first month, and it was in August last year, it was number 3 on the top 10 list of websites visited, and it had never cracked the top 10 before. So people were visiting the page, and there was lots of new resources. From what I understand, I'm not the one who does the stats. We've seen a drop in chronic absenteeism, although I don't know if it's reached the statistically significant portion yet. We have somebody else in another office who tracks those numbers, and I can't remember. I don't know if I've gotten final numbers for last year, but we were seeing some positive movement. So like with this campaign, we're especially hitting areas where there has been a lot of truancy, chronic absenteeism. We're really hitting Eastern Kentucky hard. We're hitting, of course, Louisville and Lexington because they're such big population centers. So while we're trying to spread it across the state, we're hitting the areas with higher concentrations more intensely. So sorry, I don't have any numbers, but that's what I know. And we're hoping that we're going to see that, more of a downward trend. Any improvement is good.
Yeah, and I'll have to say from the marketing perspective, you've got to see something 7 to 10 times before you act on it. So combining from last year's, campaign, and we wanted to keep it similar, but, same messaging, but, different titling and, something to catch the eye. So we expand, I would say, about 3 times the size of the campaign from last year. So super excited to, hopefully see that downward trend. Thank you, Layla. Thank you, Jen.
Thank you.
Any other questions? Miles, thank you, and Layla and Jen and all of the team that I know there were some comments about colors and layout as well. So Danielle has done a great job in putting this together too visually. So graphic design. So thank you all again.
Thank you.
Please give
us. And I put the
the
commercial in the chat, so you all watch it, and if you have any questions or anything, let us know. But if you want to share it, please, by all means, share it.
Thanks so much. Please give us feedback. Let us know when you're seeing it, what people are saying in the community, etc. We would love to have that, and we'll share it with everyone who's been a part, and we'll continue to work to try to knock this number down and get our kids in school over the course of the next year and beyond. So we're going to transition again to, I've asked Angie to give us an update on, I know a couple meetings ago in March, we talked a little bit about the medication administration training. So quite a bit of water has run under the bridge since that point. So I've asked Angie to fill everyone in on where we are today.
As Jim mentioned, this is something I spoke about a few months back as we were gearing up to roll out this new training. This was a very significant lift to do this. This training is required by Kentucky law. And we work very closely in conjunction with the Kentucky Board of Nursing in the updating of this. And just want to give kind of a high level overview and some of the things that we've kind of done to roll this out. This training material replaced our old medication training program. We started that July 1st. It is developed and guided and in guidance with the National Association of School Nurses Evidence-Based Clinical Guideline, as well as the American Academy of Pediatrics Policy on Safe Administration in Schools. And it also aligns with the Kentucky Board of Nursing advisory opinions regarding school nursing. We rolled this out to districts in early May at our end of the year branch, school health branch webinar, just because we knew this was going to be a big adjustment for schools and districts to pull off. They needed time to look at their current medication policies to see how they need to be updated to align with the newest guidance. We knew they needed to have time to prepare parents because this may completely change how their students receive medication at schools. Times change, medicine changes, so guidance changes over time. We also knew that they would need time to even notify their local doctors about what the changes were, why they were coming, and what that would mean for them. And we were very fortunate that Kentucky School Board Association has been great to make sure that all of their policies regarding medication administration aligned up with this new training, so they could provide those new packets to districts to consider when they're updating and developing medication policies. Key updates to this new training was addition of new emergency medications. Like I said, medicine advances, and we get new medicines every year. And we tried to, it's impossible to include every single medication out there, but we did our research to make sure that we included all the most commonly prescribed emergency medications in the Commonwealth. We've updated handouts, skills checklists, competency forms to make it easier for the school nurses who are doing the training and in the school districts. And we've even added additional guidance on off-label medications, which means medications that may be given for another health condition besides what it was originally intended for. We talked about stock medications, standing orders, and protocols as new topics as well. So I mentioned briefly that this was alignment with the Kentucky Board of Nursing guidance, advisory opinions. And advisory opinion guides safe nursing practice. They're not law, but they are based on evidence and professional standards. Both KDE and the Board of Nursing received many questions which highlighted the need for unified communication between the two agencies. And these questions ranged from simple things about what is an advisory opinion, is it law, even to what qualifies as an over-the-counter medicine. Is sunscreen considered an over-the-counter medicine? Is antibiotic ointment considered an over-the-counter medicine? So yeah, we anticipated lots of questions and we've got them so far. As I mentioned with an advisory opinion, it's not law. They don't carry the force of law, but it is the Board of Nursing's official opinion and serve as guidance on what they consider safe nursing practice. It's more than a recommendation and can still have consequences if you don't follow them, if things happen. As I talked about all the questions that we have received, this just solidified why putting this joint guidance document together was so crucial, because we were able to address questions across all agencies that we were receiving. It showed us as a unified group speaking on the subject that it was, based in evidence-based guidance. We just didn't decide to do it to be mean or hard on school districts or parents. And we really wanted to make sure that there's clarity and consistency across the state in providing medications to school children. So I kind of touched on this for a second about what happened if an advisory opinion is not followed. For instance, if there were an incident, there was something happened.
Well, I take ibuprofen, so I know how to stop that.
So there's school nurses. If something happened and that school nurse is called into court, this is the standard that they will be held to. This is if your board of nursing advises this, then they're going to say if you followed their guidance or not. So regarding these changes, according to the Board of Nursing Advisory Opinion number 16, it's not within the scope of practice for a registered nurse or a licensed practical nurse to administer over-the-counter medications without a medical provider's order, even without parental consent. So this includes things like antibiotic ointment, cough drops, sunscreen, and we wanted to clarify those definitions as much as we could to alleviate everyone's fears. So what does this mean basically? So districts are provided this guidance, and it is up to them to review their medication training policies and update as they choose to do so. But basically, starting with this school year, there could be no medication given at school without medical oversight or a medical doctor's order. So that meant that mom couldn't send in a 200 pill bottle of Tylenol for Johnny, and the nurse could give it anytime he needed it, because that would technically, that nurse would be operating without a doctor's order. So we realized that, and in the past, this was something that happened frequently. But as I said, medical guidance changes over the years. And so we are just changing this to reflect with current national best practice guidance. We've researched medication training programs all over the country, and this is the national trend. And this is what is recommended, as I said, by the American Academy of Pediatrics and the National Association of School Nurses. We know this has probably caused some upset within the school districts, as this is different for parents. They're going to need to get some doctor's orders for medications that they may not have had to in the past. And it could affect attendance, because there may be students who had to be sent home because they weren't able to give that child Tylenol for an earache or whatnot. So this is why we had tried our best to get this out as soon as possible to districts so they can develop their plan for what's best for their students. So as I talked about partnerships, I just can't thank our school nurses enough for all they do every day for these kids. But I'm just so proud of how they have just picked this up and ran with it. They, have been advocating for new policies in their districts. They're being brought to the table in conversations about school health that maybe they weren't at before. And so I'm just so proud of all the work that they're doing in. And I think this has realized a lot of districts that maybe they needed to strengthen their current policies as well. So that's always great. We've gotten some positive feedback from healthcare providers. We even there was even a pediatrician that was interviewed on a TV station interview supporting this this new guidance change. So that is quite reassuring. And as well, the National Association of School Nurses highlighted Kentucky's new guidance in one of their recent Facebook posts in support of this. And another thing that it's come is some school districts have secured local medical providers to become medical directors for their district to assist with providing standing orders, helping them write policies and protocols for school health issues. So this is exciting in itself because we're just seeing more and more collaboration. So I briefly mentioned medical directors, standing orders, and protocols. So districts that have a medical director are able to use a standing order. So basically that provider could write situations in which a student could receive a medication, whether it be Tylenol, antibiotic, ointment, or whatnot. These partnerships help you develop new policies. They provide expertise, and it's supporting these school nurses. This gives them a backup, so to speak, and that medical director, somebody that you could contact if you have questions about a policy. Even if something as simple as when the flu is bad, do you reach out to your medical director and say, what do you think? This is how many kids we've had out. Do you think we need to close school for a day or two or whatnot? So it's a great thing. Even with the standing order, I will point out that signed parental consent is still required with any of these orders, unless it is absolute emergency care. Okay. We are not taking parental rights away. Parental consent is paramount for any procedure or medication. And like I said, the medical director should work very closely with their district health coordinator who oversees the school health services for that district, and that work as a team to find common issues in the school that you could be addressed with a new protocol or standing orders, new policy that needs to be developed, whether you may want to, for instance, have stock epinephrine or stock Narcan available for your district. That's when your medical director is going to come into play to help do that as a team. So I briefly mentioned we have a joint guidance document that we released in July on behalf of the Board of Nursing, Kentucky Department of Ed, and the Kentucky Department of Public Health, where we provided a little more clarity on some of the questions that we were receiving, including, what's the definition of an over-the-counter order? Is a medical package, for instance, the Tylenol bottle instructions. Is that legally, can that be counted as a doctor's order, et cetera? So having this joint document, I think has been a big benefit. It's alleviated a lot of fears and questions from parents and nurses. And again, it's highlighting the wonderful collaboration between these three big state agencies that we may not see on every day, but know that we're doing it all behind the scenes. So just want to thank everyone for their patience, and let me ramble on because I'm very passionate about school nursing and school health and taking great care of our children here. And I'm happy to take any questions if anyone has any.
Mike, I think you put a question in the chat, and Angie, I think maybe addressed it, but I want to confirm that you're good with her answer, or you would like her to elaborate.
Appreciate it, Jim. Angela, I did put a question in the chat. I'm just looking for clarification because I meet with the DPPs at their regular board meetings, and just want to make sure that I'm hearing this correctly. A prescription bottle, the order written on a prescription bottle, does that suffice for the medical order from the doctor, or is there a separate document that schools are going to need to obtain along with the prescription bottle? And the reason I ask that question is because most school district policies now require that when a child is taking prescription medicine, it must be presented to the nurse in its original bottle. So that's why I'm asking that question, and I appreciate your clarification so I can help the DPPs.
Absolutely, and that is a wonderful question. And we clarified this with the Kentucky Board of Pharmacy because we want to be giving correct information. And according to the Board of Pharmacy, a prescription label does not meet the legal definition of a provider's order. It is what a prescription label is the directions from the physician to the pharmacist to dispense the medication and label it. So I know years past, that was acceptable to do that. But like I said, medicine advances and guidance changes and whatnot. So that is a new update. So yes, there is an additional form that the physician would need to complete. We don't have a standard form. The district can develop their own, or KSBA has the sample form that you're happy to use or adapt to suit your district. And then the parent still has to give signed consent as well. It's, they both have to give consent. But this is just another protection and layer of protection. The way the pharmacist explained it to me, and it made perfect sense, was when Dr. Jones wrote that order or that prescription, he may have never intended for that kid to take that medicine at school. He may have said, you need to give this at home, blah, 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 blah. And that's fine. But the bottle does not show the intent. So the doctor's order says, to give at lunch, after breakfast, whatnot. That's the intent for the medication. And hopefully was I able to clear that up?
Most definitely. And
Okay.
thank you for providing information where school districts can go to and possibly get a template document that they can amend for their districts. No, your answer was very helpful. Thank you for clarifying. Appreciate it much. And I'll be sharing that information with the DPPs as they take that information back to their health coordinators or whoever the case may be within their districts. Thank you so very much.
I really appreciate it. And we're here to answer questions anytime, the DPP, school nurses, whatever. But yeah, we've really tried to research, it and be as thorough as we can.
Thank you so very much. Very helpful. Thank you. And thank you, Jim.
There is the form KSB provides, and there's about a third or half the districts use our model form, and the other half have modified it to their own. It's procedure 092241 AP21. So every district, how many is it here? 165 districts around the state have that form. So all but 6 have that prescription medication and OTC now with the new change have adopted that form. So all but 6, and I haven't looked through the list yet to see which 6 it is, but most everybody has a form for a medical provider to fill out for prescription or OTC meds already in existence, already adopted by the board and ready to go.
Thank you, Matt. Thank you. I'll share that with them as well. Thank you.
Yeah. And I can't thank Matt and his team enough, because as soon as we told them that we were making these changes, they were on Johnny on the spot. So we knew it was going to be a big lift, but they had everything ready.
I would also note that when we did introductions, KDE does have field staff as well. So a third of the state, we've split it as their territories. So when you hear districts or folks who may need clarification or have questions, they're more than welcome to reach out to us, or they're given field staff. That map is on our website as well. If you need to help them identify who would be best to contact. Any other questions for Angie? Okay.
Thank you, everyone.
Thank you, Angie. I promise I'm going to turn it over to the rest of the group in just one moment, but I meant to mention one other thing right after Katie shared the nutrition information, and that is around the Make America Healthy Again Kentucky Task Force. So many of you may or may not know, but in the last General Assembly, there was a new task force that was created. They actually have met twice. They're scheduled to meet again later this month. Those meetings are recorded, or you may watch them. You may go in person as well. But I would encourage you to check those out. Many of you on this call have some relationship and or your work lives in the health world, how we can improve the health and well-being of our kids. So if you have not, we will put that information in the notes as to where you can find it in upcoming meetings. And I would encourage you to join in and listen to the conversation and see what's on the agenda over the course of the next several months as well. Now is the time that I know we have several folks on, but we want to give you an opportunity to share information, upcoming training, resources, etc. What's going on in your world, and how can you support everyone else in the meeting, or how can we support one another? So if you don't mind, since we're virtual, if you will raise your hand and we'll just go around until folks are finished sharing. And don't be shy. Mike.
Just wanted to share with everyone that one of the functions of the Kentucky Association of School Administrators is a lobbyist organization for upcoming legislation when the General Assembly goes into session, et cetera. A lot about what we're talking here about today does equate into legislation at some point. And as the representative to this group, this organization from KASA, if at any time your department, your agency, this committee is talking about legislation that has been pre-filed or will be pre-filed, whatever the case might be, please make sure I'm excited to be included in those conversations so that I can take those conversations to our lobbying team. We actually have a specified lobbying team that is on Capitol Hill every day as the General Assembly is in session. And we'll be happy to be that middle person going from this group to legislators through our lobbying team as we work, we as this group work on either supporting or asking to amend or whatever the case might be, legislation. So I know it's several months away still, but just want to put that bug out there that, again, we're talking a lot here today about topics that can become, have become, and we've already referenced some statutes. And KASA is excited to be that agency that is that lobbying group. Julia Piles is on this meeting. She knows my background in state law and knows I've spent a great deal of time on Capitol Hill. I get excited to be in the administration buildings and meeting. So please include me so I can include our team, and we'll work together to create legislation that is in the best interest of our most important resource, our students across 171 school districts. So, Jim, thank you for giving me the opportunity to share that.
Thank you, Mike. Who's next? Who wants to share next? No one? Oh, Stephanie Barker.
Hey, Jim. Again, sorry for not having my camera on, but I just wanted to take a minute to share a little bit about our 4th annual virtual conference that is coming up November 12th through 13th of this year. Our conference site and registration just went live about a week or so ago, and I'll post that link in the chat here for folks. But so about the conference, so we've been doing this event since 2022. It's a 2-day virtual event that brings together after-school professionals, educators, and leaders from across Kentucky to connect with one another, to learn from great speakers and presenters, and just kind of refuel, as they move into the year ahead. And so this year's theme for the conference is Thriving Together, Building Community, Strengthening Futures. And so we really wanted to kind of align with, all of the uncertainty that's happening, but also, focus on how we can all come together, work together, to ensure our programs, our kids, and our families that we support, continue thriving, this year and beyond. So again, if you visit that website there, you can learn more about the conference. We have a great new virtual platform this year. We're really excited about. If you can kind of do a little preview on the website, it's 3D, fully interactive, lots of opportunity for connecting with folks across the state. And we're, again, why we do the conference virtually, because we've heard from so many people that travel is the number one barrier to accessing professional development across the state, aside from fees. And so this lets us kind of make sure that we're reaching in all corners of the state and providing this opportunity to everyone who, might want to attend. So again, check it out. Feel free to share widely with your networks and reach out to me if you have any questions.
Thanks, Stephanie.
No, and thank you. And you all, Jim and Stephanie Bungie, have been awesome partners on this event, especially Stephanie in the planning phases. And so we're really excited, have a general schedule up right now, but we are, working on confirming speakers and sessions and everything. Hope to be able to put that all live in early September. So I'm really excited about the, proposals we've gotten so far.
Other updates? Miriam?
So I just dropped this in the chat. Just was going to say that the UK Center on Trauma and Children is starting. It's almost, I think this will be the 11th year of trauma-informed practices for educators training. This is a free opportunity for schools to send teams. There are in-person opportunities around the state, but also a virtual one that starts on November 12th, and you can click on the link or share that with schools that might be interested. This is a really good evidence-based approach to helping schools and school personnel be more trauma-informed, and I think has a direct connection to the ability of schools to meet students' needs and maybe to help address things like chronic absenteeism that may be related to mental health and trauma-related issues and things like that, and engage school connectedness and engagement and those kinds of things. And then I'm going to also drop another little, I'm going to drop a link to Partnership for Resilient Kentucky, which is a Kentucky-based network of providers and champions for promoting positive childhood experiences. If you're not familiar with the positive childhood experiences research, the research is really clear that while we know that adverse childhood experiences can have long-term detrimental impact, we also know that even for people who have had adverse childhood experiences, if they also have positive childhood experiences, it can really mitigate and blunt the negative and long-term deleterious impact of those adversities. And so we are all in a position, particularly around schools and communities, to promote those positive things for all youth. And so this is a website and an organization that has about 2 meetings a year that are free and open to the public, just to talk about and promote ways to, or help people think about ways to promote these positive experiences through the work that they do. And there's all kinds of resources, and there's actually an update with some really new research, important new research coming. So I'll just drop that in the chat.
Thanks so much. Kelsey.
Yes, I just wanted to follow up from Stephanie's presentation. I likewise have not seen the exhaustive list of schools recognized as America's healthiest schools, but that'll be coming out tomorrow, of course. But I've been doing my own research to our listings on our account with the Alliance, and I was able to verify that 4 of schools in our region received the All-Star designation in Indian Hills Elementary and Millbrook, Crittenden County Elementary, and Christian County Middle School. Last year, there were only 10 All-Star designations being recognized across all 9 areas throughout the state. 8 of them were in Barron County, and then we had Millbrook and Murray Elementary. So proud of that, but that's just a quick little update, but more information to be forthcoming on that.
Thank you, Kelsey. And just for some of you all who have not joined us in the past, want to give a shout out to Kelsey and his team in Western Kentucky. Kentucky ranked 3rd in the nation as far as the number of Healthy School Awards that they received in 24. And I don't suspect that will be any less this year. But the work of his team and working with those 120 plus schools in the western part of the state is tremendous. So kudos to you and your team, Kelsey, and we look forward to seeing those numbers tomorrow and adding additional schools across the state over the course of the next several years too. So I'm sure Kelsey is willing to share the great work that they're doing, and we will definitely make sure in the minutes that we include the listing of the news of the 25 schools when it comes out tomorrow as well. Anyone else? I'm going to pause just for a second, and if you still have something you want to share, go ahead and raise your hand. As we wind down, I do want to remind you that our next meeting will be virtual, as this one is. It will be on September the 30th. The state board meets on October 1st, so it will be next month. This is the time that we'll meet the day before. So September 30th, virtual, as we are today. The other thing I wanted to mention is be thinking about our December meeting, which is scheduled for the 2nd. There was conversation when we were in person together at the June meeting that we thought we might potentially come together maybe in Fayette County. Please let us know if that's something you're interested in, and we can begin working on that. But as the group noted a year ago, they wanted to meet twice a year in person. So that would be June and December in that regard. So if you'll hold that on your calendar in the event you don't have it circled yet, please do so. Any final comments, questions, or resources before we sign off today? Well, we want to thank each of you for your time, for the work that you do each and every day, for your partnership as well with the department and with each other. This work in Kentucky, we still have much to do, but this work would not be possible without everyone sitting around the table and having these conversations and rolling your sleeves up and and addressing issues that we see. So thank you on our behalf. And if there's anything that we can do to assist you in your efforts, please don't hesitate to reach out to us. We will follow up with minutes. And in the meantime, enjoy the rest of your summer. And we will talk next month, if not before. Thanks, everyone.